Hey everybody, I want to introduce you to Q2. Thanks a lot for tuning in, and I hope you're going to get a lot out of this segment today because we're going to talk about something that's a problem, unemployment in the United States right now, and how it's impacting our healthcare system. You're going to learn how the federal government is going to pay for 65% of your healthcare costs, and that's what we're going to talk about today. Well, hello everybody, and welcome to Q2. You know, if you're looking at this video, that means that a friend of yours has sent it to you because you may have lost your job, or you know somebody that lost a job, and we're here to talk a little bit about COBRA and how it works because it's really confusing right now. And so, you know, let me tell you a little bit about myself. My name is Quentin Moses, and some of you may know me from New York, where I worked as 20 years on Wall Street. And then in the late 90s, I left, and we moved down to South Florida, so some of you may know me from South Florida, and we did quite a bit of work in art consultancy down there. And about 2.5, 3 years ago, we moved to the ATL, and have been loving the ATL. And since I've been here, I've gotten my license in health insurance. And I was talking to a friend of mine about his COBRA and what was going on, and realized that a lot of people didn't know what was going on, and it can have a big impact on your financial future. So I'd like to introduce you to my friend, Mike Harris, and he's going to tell you a little bit about what's happened to him over the past 6 months.
Certainly. Quentin and I are friends and neighbors, and I was talking with him about my situation. I was actually laid off of my job about almost 3 months ago, back in the middle of early December, I guess. And with that, I was invited to get onto the COBRA plan, or buy some alternative insurance, and all of it's really, really expensive. And we're talking with Quentin, he said, well, maybe there's some things, especially now with the new administration and the stimulus package that they put together, that would be helpful to you. And we got to talking about what's available, and hence we're here now for Quentin to give me and all of us a little more information.
Well, let's talk about what COBRA basically is. COBRA is just the federal government allowing you to pay for your group health insurance. Most people don't realize the true cost of their group health insurance because your employer is picking up 85, maybe even 90% or more of the cost. So, you know, when they pull that 100, 125 bucks out of your paycheck, you know, every month, you think that's the cost of your health insurance, and it's not. That COBRA bill you got is the real cost of your health insurance. So why is it, you know, so much money? Well, because, you know, group insurance is guaranteed issue. So, well, look at you, Mike, you're in good shape and you take care of yourself, because I know you're in the gym at 5:30 every morning. So, you know, you're nice and healthy, but even if you weighed 400 pounds and had, you know, heart disease, they would still take you into the plan. So Mike, why don't you tell us a little bit about your new business, because what you do with your new business is typical of what a lot of individuals are doing now and couples are doing now with a business on the side, and they want to take it full time.
So one of the things that I've decided to do in this time off that I have is to start an art consultancy where I help collectors acquire work, help collectors or galleries or owners of work to deassess or sell work, help galleries and museums to do exhibitions and shows and do audience development things. So that's my business because that's my passion. So I'm going to be working independently out of the house. Don't really have any staff. It's just pretty much me. And I need some sort of coverage that will be able to carry me through. I'm going to have to set up all the usual business apparatus, you know, buying health insurance and all of that. So what we're talking about today is very, very relevant to what I need to do.
And this is typical, because when you're setting up a new business, the most important thing is getting the health insurance. That's what most people don't realize. In fact, I taught a course for SCORE on this, because the health insurance is tricky, because you have a business, and very often in this environment, a husband and wife working together, they're doing this business on the side, and each one may have group insurance, or maybe only one of them has group insurance carrying the other one. Now one gets laid off, or they both get laid off. So this question of what do I do? What do I do with this health insurance? Well, with the COBRA, since the government's going to pick up 65%, that's a no-brainer. Okay, you go ahead and take that. But remember, COBRA's temporary. It's only going to last for 18 months and the discounted version until the end of the year. So why should you seriously consider an individual plan in lieu of COBRA or in addition to COBRA? Because here's what can happen to you. Let's say while you're on COBRA, well, let's say you have one of these pre-existing conditions, okay, of cancer, heart disease, diabetes. You will not be able to get health insurance at all. Like I said, you go into the high-risk pool, and it's incredibly expensive. So if you get your own individual plan, when you can qualify and you're healthy, then you know you own your own plan. So even if you get sick during that period of time, you will still be guaranteed that you have your insurance, and you don't have to worry about that. Because if you don't, and you get sick like that, you might not be able to get, you will not be able to get any insurance until you're 65 years old. Hopefully within the next couple of years, there'll be some changes in Washington, but right now, that's the way it stands. So this is the real crucial part that most people don't understand. It's very confusing. And that's what I think I can help you with, and that's why we made this little video. Now, one of the things now that's happening, you talked about, is the stimulus package. And that's what a lot of people don't understand, and this is really important because it can save you a lot of money. In the stimulus package, Congress is going to pay for 65% of your COBRA.
Wow.
So if you were paying $1,000, if that bill they sent you was $1,000 for the COBRA, it's only $350. So that's why you can't get in touch with your benefits department now, because they're trying to mail everything out.
Yeah.
If you got laid off between September 1st and December 31st of last year, then, and you couldn't afford the COBRA, they're now going to offer it to you at this reduced rate of only 35% of the cost. If you currently are on COBRA, you can get the reduced rate until the end of the year. It may take a couple of months because they're trying to figure out, you know, the company's trying to figure out how to do the accounting, but that's the deal. So one of the things is what happens after COBRA, since it's temporary, and the real reason you have COBRA in the first place. If you get sick, and when I talk about sick, I mean heart disease, cancer, or diabetes. In the state of Georgia right now, you will not be able to get an individual policy. So what you would have to do if you were in that situation, if you would have to elect COBRA, keep COBRA for 18 months, and the 18 months you would go in the high-risk pool. And this high-risk pool is just catastrophic coverage, and it's incredibly expensive, but at least you have something. Hopefully by that time, there'll be a new health policy, so we won't have to worry about that again. So we were talking about what happens if you're going to have a business and go full-time, and what's the risk if you have the COBRA. So here's what's going to happen. Let's say that you have the COBRA, and you're healthy. So that's when you want to apply for individual health insurance, when you're healthy. So go ahead and apply for it, and then you know you have it. Now, if you, like I said, if you don't do that, and you have to go into this high-risk pool, the difference in premiums is substantial, and the coverage is going to stink. And if neither one of you gets, jobs, and nor when you try and get this high-risk pool, it's going to be really, really high, you will be, not only will you be uninsurable, you won't have any insurance. And you won't be able to get any insurance until you go to Medicare at 65 years old. So this can have a dramatic impact on your financial future. So all we wanted to do is give you some quick information about this. I have a blog, which is called the Q2 blog. You can find me on Facebook. You can find me on LinkedIn. My contact information is there. And when Mike Harris has his website up, on the right-hand column, you're going to be able to read about his whole business. And there's also some other helpful information there. So I want to thank you guys for the time. And if you need me, you'll be able to contact me. Well, we've talked about a lot of information today. And there's even more information, and I'd love to help all of you the best that I can. So you can reach me, first of all, on my blog. Everything's in detail on my blog. And you can find me at Facebook, Quentin Moses, Facebook. You can find me on LinkedIn. Just look for Quentin Moses. I'll be your friend. Also, you can contact me at my email, which is quentinmoses@gmail.com. And also, you'll be able to learn more about Mike Harris's business and our wonderful producer and director.